Well, I want to thank everybody for coming to today's very special presentation, Learn the Latest, the Impact of the Budget Bill on Medicaid. We are joined by Connor Griffin, who is the Director of Health Care Advocacy with the ARC of New Jersey. The Health Care Advocacy Program promotes quality health care for individuals with intellectual and developmental disabilities throughout New Jersey. Connor received his master's degree in public health with a concentration in health systems and policy from Rutgers University. He received a Bachelor of Arts in public policy with a minor in public health from the University of Delaware. And with that, I'm going to turn it over to Connor. Connor, thank you so much for presenting today. We will be doing the presentation followed by a Q&A session, and then we will have a campaign activity for everybody to take part in at the end as well. So please stay until the end to get the full effect of what we are presenting today. So I will turn it over to you, Connor. Again, Connor, thank you so much for presenting this and for being here today.
Well, thank you for that great introduction, Erin. Good morning, everyone. Once again, my name is Connor Griffin. I'm the Director of Healthcare Advocacy here at the ARC of New Jersey. And before I get into this morning's presentation, I will just encourage everyone, if you do have any questions following up from today's presentation, I did include my email address here at the bottom of the slide, healthcareadvocacy@arcnj.org. Please feel free to email me any questions you have following today's webinar. So before I actually get into the specifics of the new budget bill, I do want to start out with just some basics around what Medicaid looks like as a whole, particularly New Jersey Family Care, which is New Jersey's Medicaid program. So for those who get a little bit confused about these things, as I know it can be very confusing, Medicaid, Medicare, they sound very similar. Medicaid, which is what we're going to focus on today, is a jointly funded federal state health insurance program that provides comprehensive health care coverage for people specifically in New Jersey, which we'll be covering today. Every state has a different name for their Medicaid program. So New Jersey Family Care is synonymous with Medicaid in New Jersey. They are one and the same. Other states have different names for their Medicaid program, but each state has a unique name. And in New Jersey, it is New Jersey Family Care. Now in New Jersey, NJ Family Care or Medicaid, I'll be using both terms through this presentation, covers more than 1.8 million individuals. So nearly 2 million people in New Jersey are covered by the state Medicaid program. And of that 1.8 million, over 300,000 individuals are enrolled on aged blind disabled, otherwise known as ABD Medicaid, which is a specific type of New Jersey Family Care Medicaid. The primary source of healthcare coverage for a lot of people with intellectual and developmental disabilities, otherwise known as IDD, is the Medicaid program, is New Jersey Family Care. Now, as I just mentioned before, there's really two main types of Medicaid in New Jersey that both fall under the New Jersey Family Care umbrella. The first one is sometimes known by a few different titles. It's sometimes called Affordable Care Act, shortened to the ACA, Expansion Medicaid, or Modified Adjusted Gross Income, or MAGI, NJ Family Care Medicaid. And why it's called Affordable Care Act ACA Expansion Medicaid is because New Jersey is one of the states that opted to expand its Medicaid program to individuals with income up to 138% of the federal poverty level, as was allowed under the Affordable Care Act. And the majority of states did opt to go for that expansion. The other main category of Medicaid programs in New Jersey is, again, those age blind disabled programs, which those in of itself is an umbrella and it includes several other programs. I'll be covering that on the next slide. The majority of adults with IDD tend to have an ABD type of Medicaid, not the ACA or MAGI expansion Medicaid. But first, I will go through the ACA expansion Medicaid, which is also sometimes just known as regular Medicaid, which ensures children under 19, which this includes the Children's Health Insurance Program, otherwise known as CHIP, as well as lower income adults and pregnant women 19 and up. Eligibility is based on someone's gross monthly household income. So if someone is living independently, they're a household of one, it'll be based on their monthly income. And that limit for a single adult in 2025 is $1,800 a month. Those income limits change if there is a household with multiple people, or if an individual is still claimed as a dependent by their parents, they still live at home, then what usually occurs is that New Jersey Family Care looks at all the members of that household, adds up their combined income, and sees whether that individual who's applying for Medicaid is able to financially qualify. So, as a result, for ACA expansion Medicaid, generally an adult individual is not going to be able to qualify if they are claimed as dependent, because usually, if one parent or both parents are working, as is typically the case, that means it's unlikely that the adult child will financially qualify for Medicaid. The other way that ACA expansion Medicaid does not work is if the individual already has Medicare. So if they're already on Medicare before they get Medicaid, they can't qualify for this type of Medicaid. As I already touched upon, though, ABD Medicaid is typically going to be a better option for an adult with IDD, and that is the type of Medicaid that most individuals tend to have. As such, that's going to be more my focus as part of today's presentation. ABD Medicaid insures people who are 65 and older, adults 19 to 64 who have Medicare, and people who are determined to be blind or disabled either by Social Security or the state. And I just want to point out, you might be wondering, how does someone have Medicare under that typical age of 65? Well, if a person has a parent who has passed away, became disabled themselves, or has retired and started collecting their Social Security retirement benefits, that can entitle an adult with a disability to receive Social Security disability benefits. After 2 years of receiving that benefit, they become eligible for Medicare. So if someone's in that 1964 age range, they have a disability and they're receiving Medicare, they can't get the ACA expansion Medicaid, but they can still qualify for ABD Medicaid. And someone either needs to have that disability determination done through Social Security. For example, someone that was found eligible for supplemental security income or SSI, they have a determination done, or they can instead have that diagnosis made through the state. The state has a medical review team that uses the same criteria as Social Security to see if the person meets the medical criteria to qualify for ABD Medicaid. Now, as I mentioned before, there's several different programs that fall under this ABD umbrella. So it's not one size fits all. There's several different programs. They differ in how someone financially qualifies. They can differ in how someone qualifies based on their health or for medical reasons. And you can see some of the common examples here include someone that does get approved for SSI. They have ABD Medicaid. DAC Medicaid or Disabled Adult Child Medicaid when a person comes off of SSI, typically because a parent has filed for Social Security retirement and the adult individual starts getting a different Social Security benefit, that Social Security disability. There's the New Jersey Care Special Medicaid program, which is processed through the local county boards of social services. There's the New Jersey Workability Medicaid program for individuals who are employed. They can qualify for NJ Workability. Managed Long-Term Services and Supports, or MLTSS, is for individuals with a higher level of medical need. They need a nursing level of care. Or there is what was previously referred to as non-DAC or otherwise Medicaid only via the DDD waiver unit. These are individuals that have much higher income they oftentimes can't qualify for those other Medicaid programs. But of course, someone needs that Medicaid eligibility in order to qualify and remain qualified for services through the Division of Developmental Disabilities, otherwise known as DDD. So now, having outlined Medicaid in thorough detail, I'm going to get into the budget bill, otherwise known as HR 1 or One Big Beautiful Bill Act. It's also been referred to as OBA, which I'm going to refer to it as OBA just for convenience sake throughout this presentation today. But the Federal Reconciliation Bill, OBA, was passed by Congress and signed into law by the President on July 4th, so about a month ago now. And you've probably seen many things about this bill in the news and online. There are other cuts included in it. There's cuts to SNAP. What I'm going to be focusing on today, though, is the largest impact of the bill concerning the Medicaid cuts. Now, the Congressional Budget Office, or CBO, which is a nonpartisan office, they estimated over $1 trillion in cuts over the next 10 years, and they estimate the largest cost savings are from new eligibility requirements, which are going to reduce the number of people on Medicaid and cutting provider payments for those providers who participate with Medicaid. Now, I want to highlight there was a very important update from the New Jersey Department of Human Services during the most recent Medical Assistance Advisory Council meeting, or MAC meeting, which was just a few weeks ago on July 17th. And much of the information I'm going to be drawing on during today's presentation was highlighted, comes from that presentation that was given by the Department of Human Services on July 17th. During that presentation, there was an excellent overview provided by Greg Woods, the Assistant Commissioner of the Division of Medical Assistance and Health Services, which oversees New Jersey Family Care and the state Medicaid program, regarding the specifics of OBA. I included here right on this slide, and it'll also be included at the end, that you can easily click on the links to both access the MAC meeting slides so you can see that presentation, and you can view the recording so you can watch it that Greg presented on the 17th. Now, one of the big questions when this bill was first passed is who exactly will be affected? So it's important to know with OBA that it is primarily targeting the Affordable Care Act, or ACA, expansion Medicaid population. So those working age adults between the ages of 19 and 64 are the primary target of several different provisions in this bill. So I pointed out in my previous slides with the differences in Medicaid. There's the regular ACA expansion Medicaid that's available in New Jersey, as well as the ABD Medicaid. So the main two provisions in this bill, which have been reported on the most, you've probably seen the most, are these mandatory work requirements or community engagement requirements, and the increased frequency of eligibility checks. So those mandatory work requirements, again, for working age adults, 19 to 64, that they must work 80 hours a month or otherwise be completing 80 hours a month of community service or attending school for 80 hours a month. The increased frequency of eligibility checks, some of you might know, right now, since the end of the pandemic, Medicaid resumed once a year or every 12-month renewal checks for people enrolled on Medicaid, though that does exclude people on SSI. Now, instead, it will be twice a year or 6-month redeterminations. But again, these two provisions are targeting individuals on Affordable Care Act ACA expansion Medicaid for working age adults between 19 and 64. Now, the work requirements do have many exemptions. I listed some of them here. There's a full list available in those MAC meeting slides that were presented on July 17th. But you can see among the exemptions include pregnant and postpartum members, individuals considered, quote, medically frail, and that includes individuals with serious mental illness, substance use disorder, and intellectual and developmental disabilities. It also includes incarcerated or recently incarcerated individuals, foster youth and former foster youth under the age of 26, parents or caregivers of dependent children under the age of 13, and individuals with disabilities. And again, there are some certain other groups you can see highlighted in those max slides. States must implement by December 2026. So it's really, they're looking at a January 1st, 2027 for this really to be rolled out and to be in effect for those ACA expansion working age adults. The 6-month eligibility checks, again, Medicaid agencies, they must start redetermining eligibility for the ACA expansion group once every 6 months. So that'll be twice a year that people need to prove they are still eligible for Medicaid if they fall under this ACA expansion group. And since that same group is subject to the new work requirements, they're going to need to make sure that they prove they meet the requirements for both the eligibility checks, whatever is required during that, as well as to prove they're either doing the 80 hours a month of work, school, or community engagement. And it's a similar timeline. It's effective for determinations that are occurring on or after December 31st, 2026. But once again, I want to stress this does not apply to individuals who are either enrolled on Social Security, Supplemental Security Income, or SSI, or ABD Medicaid. So if someone is on the NJ Care program, they're on New Jersey Workability, they're on MLTSS. If you're on one of these programs, you're going to be exempt from these two main provisions. So just keep that in mind as we move forward. Now, I do want to highlight some other key provisions that were included in OBA because there was a lot. It was a very long, detailed bill, one that the state and Medicaid are still working through all the specifics of. So I wanted to highlight a few of the other major provisions. And I know some of this might be a little bit confusing, but the first one is restrictions on provider taxes and state-directed payments. In simple terms, you might have seen these thrown around in the news as well. They really relate to the amount of money that the state is able to raise by funding providers, and Medicaid dollars that are spent by the state are typically entitled to a federal match. So these are tools that the state uses to raise more funds for the state Medicaid program and the overall health care system, as well as payments that are made to Medicaid providers like hospitals, other inpatient clinics, or other providers that participate in the Medicaid system. So going into effect over the next several years, there are going to be limitations on those provider taxes and state-directed payments. States that have expanded their Medicaid are going to be forced to reduce them over the coming years. And really what that means for the state, for Medicaid, for the budget in the years moving forward is there is going to be a significant loss of funding for both the state and for Medicaid providers such as hospitals. Number two, the elimination of Medicaid eligibility for certain categories of documented immigrants. You can see here that implementation timeline is October 1st, 2026. This means that, plain and simple, more Medicaid members who were previously eligible, when those new requirements go into effect, unfortunately, they are going to lose their coverage. There are also changes to retroactive Medicaid or CHIP eligibility. So previously, it was retroactive eligibility for up to 3 months, beginning January 1st, 2027. This is being reduced to just 1 month for the ACA expansion Medicaid members. It's being reduced to 2 months for all other members. So presumably that includes individuals enrolled on ABD Medicaid. that instead of there being the previous 3 month retroactive eligibility, now it is going to be limited to 2 months effective in 2027. And lastly, there is going to be some mandatory cost sharing, otherwise known as copays, for certain members, and that's beginning later than these other requirements, October 1st, 2028. And again, that predominantly applies to the AC expansion population, but plain and simple, mandatory copays are going to just be more financial burden on Medicaid members. It's more that a person has to pay out of pocket for the prescriptions or the other services that they require to maintain their health. Now, to go into some of the financial impacts, again, to just lay it out all a bit more plainly, in summary, OBA is going to result in reduced payments for Medicaid providers, less federal funding for New Jersey. Again, remember back to that first slide, Medicaid is a state and federally financed program. So the federal government puts significant money towards New Jersey's Medicaid system. The new provisions in these bill, they are going to, unfortunately, they're going to end up meaning that there is less federal money coming into New Jersey for the state and the Medicaid program. And it's going to be more financial burden on the state and counties, especially an administrative burden as well as a cost burden, because the counties are going to need to process both the 6 month eligibility checks as well as the new work requirements. This is going to require more paperwork, more verifications on behalf of members. So it's overall just going to create more financial and administrative burden for the state and the county offices. As I touched upon a little bit before, the state is still in the process of analyzing the full extent of the budgetary impacts over the coming years, what this bill means for New Jersey, and what those financial losses are going to look like for New Jersey family care for the state Medicaid system. So the plain and simple truth right now is that we just do not know exactly how OBA is going to fully impact Medicaid services. Um, Presumably, one could imagine that if the state is going to face some budget hardships in the coming years, optional Medicaid benefits. The Medicaid program includes mandatory benefits that must be provided, and there's optional Medicaid benefits that a state has the flexibility whether or not they want to authorize. Um, Optional Medicaid benefits, such as home and community based services or HCBS, vision and dental services, those are a few examples of things that could be impacted. Um, we know from past years when there was, you know, lean years with tough state budgets, those have resulted in the past that there is a reduction in optional services, as well as cutting payments for Medicaid providers. Those were tools that were used in the past, and it's possible they could be tools that are needed to be used by the state, by Medicaid in the future, but we simply do not know at this time. So this is another summary slide, kind of a snapshot of some of the projected New Jersey impacts overall of what OBA could mean for the state over the coming years. So just to pick out a few things here on the enrollment side, that means up to 350,000 individuals at risk of losing their Medicaid coverage, and 15,000 to 25,000 individuals losing coverage based on the new immigration eligibility criteria. From the state financial perspective, it's again, these numbers came from the MAC presentation from the Department of Human Services. They estimated a $400 million loss generated annually by HMO assessment. Again, that money that's raised by the state with those provider taxes, those state directed payments, a loss of $45 million due to reduced federal support for emergency Medicaid. And the state is ultimately going to need large investments in new eligibility systems and resources. That's going to the new provisions in this bill, the work requirements, the 6-month eligibility checks. Again, those are going to be a lot of strain on the state and county offices because they need to process that information. They need to have the systems in place to accommodate those new requirements. The provider financials, hospitals could lose almost $3 billion annually due to the restrictions on the provider taxes, those directed payments, and it's projected billions of dollars in losses across the state healthcare system due to overall reduced Medicaid enrollment. And then a few other provisions here, reduced utilization of services due to new cost sharing. Otherwise, individuals are using less services, utilizing their Medicaid benefits less because of some of these new provisions, like the mandatory copays, increased member burden to prove eligibility, submitting all the documentation, the paperwork that's needed to prove is the person, are they working, are they in school, they're doing community service, and increased eligibility workload and reduced county option revenue for county government. So this is kind of the snapshot of the different New Jersey impacts across these different areas with the OBA bill. In final summary, though, the main takeaways that I really want to highlight, and if you don't take anything else from this presentation that I provided in the slides before, this main takeaways slide. So again, most individuals with IDD, those who are enrolled on SSI or an ABD Medicaid program like Workability, like MLTSS, like someone that is considered a disabled adult child, they had SSI and they transitioned to a different ABD Medicaid program, they will not have their Medicaid eligibility affected by the new work requirements or the 6-month eligibility renewals. Those are provisions that are affecting individuals on the ACA expansion regular Medicaid program, not ABD. Many of the OBA provisions, they do not go in effect until 2026 or later. So we're not necessarily going to see the impact of several of these things right away. Different provisions in the bill, you saw they have different timelines for implementation or when the state is required to implement them by. So these will gradually, different things will go into effect over the coming years, though the work requirements and the eligibility renewals, those will essentially be beginning January 1st, 2027. Once again, the full extent of OBA's impact is still being reviewed by New Jersey and the Medicaid agency, by New Jersey Family Care. Again, it's a very long, detailed, complicated bill. The state has a lot of work to do to fully analyze it and understand the impacts of how it's going to affect the state over the next 3, 5, 10 years moving forward and what that means for the Medicaid program. In that same vein, we do not know how Medicaid may need to react to what's likely going to be significant funding cuts, really beginning in that federal fiscal year 2027, which begins October of next year, 2026. But again, I want to highlight one more time that individuals who are currently enrolled on Medicaid and DDD services, they're not being disenrolled at this time due to the passage of OBA. Anyone being disenrolled from Medicaid right now are for routine reasons, for other reasons. It is not based on the passage of OBA. Again, that was signed into law on July 4th last month. I also just want to highlight a few tools and resources here. Once again, you can access the slides and recording from the July 17th MAC meeting that included the Department of Human Services presentation on OBA, the full presentation from Assistant Commissioner Greg Woods. The ARC of the United States has an action center. We highly encourage you all to get engaged. Go to the arc.org/action, and they also have a Medicaid toolkit that has a lot of helpful information as well. And of course, make sure you're signed up for the ARC of New Jersey action alerts. You can follow that link there and make sure you are notified of all state, federal advocacy updates, and how to stay involved when we call upon you to do so, because it's so important to remain engaged with your legislators, both at the local, state, and federal levels. But that brings me to the end of my presentation for today.
Excellent. So we do have two questions. We have someone ask, so my son on workability with autism is exempt from the every 6 months re-eligibility, redetermination, sorry. He got SSI before 18, and so he didn't qualify for ABD.
Yes. So New Jersey workability, again, is considered one of the ABD programs. He will be exempt from those 6 month eligibility checks. So if he's on workability, should just have to worry about doing that annual renewal going forward. So once a year or every 12 months.
Okay, and that it goes for everyone who is on an ABD program and or who gets SSI. It remains the 12-month redetermination.
Yep. So if someone's on SSI, they don't even have to do the 12-month redetermination, because if someone qualifies for SSI, they automatically qualify for Medicaid. But anyone on a different ABD Medicaid program like workability, they have to do the 12-month renewal.
And then we have someone asking if you can elaborate on what retroactive means. Does that mean providers won't be reimbursed?
So it's not necessarily that providers won't be reimbursed. It's so retroactive Medicaid coverage is that they can confirm someone's eligibility. Again, it's right now it's up to 3 months before, and that also means that if someone has unpaid medical bills that weren't covered, but they would have been covered if they were found eligible for Medicaid, someone can actually submit those for reimbursement to Medicaid. But once that new provision goes into effect, it's going to be only 2 months instead of 3 months.
So that's more not for the providers, but more for the recipients.
Hmm. Right.
Excellent. If anybody else has any questions, please feel free to put them in the chat box. I want to just remind everybody that this is being recorded, will be put out on our social media, on our website. So please be careful what information you're providing if you do have a question. We want to make sure that we're not giving out extremely personal information. But there are a few ways that you can get in touch with Connor as well, should you have any issues or if you want to talk more one-on-one or anonymously with Connor. So first I will put the Health Care Advocacy website in the chat for everybody. This has a lot of great information, and it also includes the problem intake form that Connor has also. This is a great way to get in touch with any specifics, issues that you're having as well. And that link is also in the chat. So we do have a few more questions. I recently applied for Social Security as I retired. I received a disability update report. How do I complete question number 3?
I can't say I haven't memorized what question that might be.
The best thing would probably be to fill out your problem form on your website to get more
Hmm.
information about that. So
Fill
again,
out the problem form or send me an email and we could go over more specifics there.
and then my son is 33 years old and he was switched to Medicare when my husband died. Will he have to get the 12-month renewal process?
So if he has Medicare, that's great. For Medicaid, there's the 12-month renewal. For Medicare, there's not a 12-month renewal. So if he qualifies for an ABD Medicaid program, then you're still looking at the 12-month renewal. Since he has Medicare, it's kind of a moot point. He wouldn't be able to qualify for the ACA expansion Medicaid anyway, which that's going to have the new 6 month eligibility checks.
Okay. How does the bill impact overall funding for the Division of Developmental Disabilities?
At this time, that's not something I can comment on because I do not know.
It is still very early. Again, we do obviously anticipate more information coming as time goes on. Um, yes, so Sonia asked if this is going to be available to review again online. It is being recorded. You will also get an email tomorrow with a link to the video, the slides, and a survey if you wouldn't mind filling out. That will all go out tomorrow. Even though a person with IDD on Medicaid will most likely not have their Medicaid eligibility affected, how could their current HCBS services be affected?
Right. And that, as I mentioned, again, it's presumed that if there are financial difficulties for the state and the Medicaid program in the future, there could be reduced funding for HCBS. That could be an option that the state opts to go for or feels they have to. But at this time, there's no way of knowing what options the state might pursue. Again, this is going into effect over the next several years, so the state isn't going to feel the impact of the provision of these bill of the provisions in this bill until January 1st, 27. So it's hard to predict right now, but ultimately, that's not something we know. That's going to be up to the discretion of the state and the Medicaid program.
And then we have a question of the bill goes into effect in October 2027, correct? But you had covered that in a slide. It varies. Different parts go into different effect at different times.
Yes, there is several different timelines for different provisions in the bill. So if you want to go back in my slides, you can see what some of the different timelines are. And there's also even more detailed in the MAC meeting slides. But the two primary ones that I focused on, the work requirements and the 6 month eligibility checks, those are essentially December of 2026 that the state must implement those by. But for other provisions in the bill, there's different timelines all over the place.
Could this loss of funding lead to higher levels of institutionalization?
It's totally possible if there is a reduction in HCBS, but we just do not know at this time.
And then we have, what does this mean for split companion Medicaid in New Jersey?
So for split companion Medicaid, that's a little bit different. Again, we would have to wait for guidance on the state if that's going to be impacted. Um, Lots of great questions, just unfortunately don't have answers for them right now.
And then uh, we have, this is a great resource. Will you be affected? Will there be a loss of access to info?
Hopefully not. As long as we remain funded, we'll be putting this great information out there.
Yeah, the same for all of our programs at the ARC of New Jersey. As long as we can, we will be providing information and resources. We're very lucky to have Connor as part of the ARC of New Jersey team. So just if you're not already following our programs on social media or in our newsletters, please do so. That is how you can get the most up-to-date information of what all of these changes may mean. Bob did go into a little bit of detail on what question 3 was. It asks whether working has been discussed with his doctor. He is autistic, cognitively disabled, and has never worked.
Okay. But why don't we follow up on that question offline?
So I did put Connor's email in the chat as well. Please feel free if you have more information you would like to gather but don't want to share on this very public forum right now. Please feel free to reach out to Connor either through email or by filling out that problem intake form. And I do not see any other questions right now. If you're like me and you think of a lot of other questions once the webinar is over, again, please feel free to email Connor or our program, and I will put our email in the chat as well. We are NJSAP at arcnj.org. And if there are no other questions, oh, can you share some examples of HCBS services for attendees?
Sure. So HCBS services, home community-based services, include what's provided if an individual is enrolled with DDD on the supports program and the community care program. Those day services, group homes. These are Medicaid waivers. Again, they're optional benefits. They're not mandatory that a state is required to provide those services. So a lot of those services provided through DDD, like day programs, group homes, they are included in HCBS. So technically, if there is threats to HCBS, those could potentially be threatened with funding in the coming years. But again, at this time, there's been no indication from the state, there's been no indication from DDD. It is extremely early, and we just do not know at this time. But the state is likely going to have to get creative in working around these anticipated budget and financial difficulties that are coming our way because of this bill.
Someone asked if PPP will be affected or will be cut, possibly.
So PPP could potentially be impacted.
And then another question just came in. I'm sorry I'm late to the meeting, so if somebody already asked this question, I apologize, but how will work requirements affect individuals who already have SSI and DDD? For example, will exemption paperwork need to be filled out on any sort of regular basis? Also, what happens if they work, i.e. minimum wage job, part-time, will that cause work requirements to kick in?
So if someone's enrolled on SSI or ABD Medicaid, once again, they will be exempt from the work requirements. I would imagine that the state will have on file what the person's enrolled in. They know if they're enrolled in age blind disabled. So cannot say at this time whether the family would need to submit anything specifically regarding that exemption. But we do know we've been given pretty confidently from the state that those groups, SSI, ABD Medicaid, they are exempt from the new work requirement.
All right. So, at this time, I would love to talk about a campaign that our program has created, just to kind of express the need for Medicaid and how many people need Medicaid to live independent lives or to live healthy lives as well. We have a frame that you can fill out with your picture and post on social media. There is a form you can fill out if you need help with the template. It will fill it out for you. And then if you would prefer, you can also email us a picture of a selfie. I'm going to share what that looks like right now. So we have a frame that you can put your picture in, post on your social media. We tag legislators and decision makers who are a part of making these determinations. So we feel that it is important to let them know the impact that this is going to have on individuals around New Jersey. And so we will put this in the chat. I put the form that can help you fill out. And if you do fill this out, email it back to us. We can post it on our social media as well. Or if you tag us, we can share it. We just really want to let everybody know how many people this is going to affect. A lot of people. We also have created a campaign page. So if you would like to stay up to date with campaigns that we are providing or are a part of, you can do so also by visiting our new campaign page on our website, and it also has other resources and information as well for how you can just participate and get some action out there because that really helps. We don't have a lot of answers for everybody right now, but we still would love for people to take action. We are not going to let this kind of disappear, even though a lot of changes aren't happening for years. It is going to be something that we will continuously talk about. We will continuously post updates as we have them. We will continuously let everybody be aware of, the changes that are happening or that could happen. So please, again, subscribe to our newsletters, subscribe to our social medias. That is how you can get the most up-to-date information on what is going on. I will also put this template in the chat for anybody who would just like to take it and fill it out themselves instead of the form. But please take a moment when you receive the email tomorrow to fill out the survey. Let us know what you thought, if you would like more of this topic, which it seems like everybody does. We don't have a lot of answers right now. So bear with everybody. We're doing the best that we can right now. We really appreciate you coming on to learn more about this. And Connor, we really, really appreciate you coming on to do this presentation. You're so knowledgeable in what seems like a very, to me at least, very hard to understand situation. And I know that there's a lot of fear going around, so we want to address it with actual facts and information that we do know. We do appreciate you. We have a lot of thank yous in the chat. We have a lot of appreciation. So thank you again. Thank you, Connor. And thank you, everybody. Again, this will be recorded. If you have any questions, please feel free to reach out to Connor or our program. And we hope that everybody has a fantastic rest of your Friday and a fantastic weekend. Thank you all so much.
Thank you, everyone.